So a normal blood pressure is 120/80, and that is where you really want to be. But if you do notice that your blood pressure is creeping up a little bit, I do think it's important that you really keep an eye on that, because a lot of times people are not even aware that they are walking around every day with high blood pressure. And that can really lead to other things. That can lead to heart attack, stroke, cardiovascular diseases, and some of those things can be prevented if you can adhere to a proper diet, make changes as far as your activity, especially if you have a family history. So if you have somebody in your family that has high blood pressure, it's even more important that you keep your eye on what your blood pressure is, and we check that routinely to make sure that there's not an underlying cause. So sometimes you may have high blood pressure because you have something wrong with your kidneys, or you know there are other things going on. So we want to make sure nothing else is going on. And some people don't have symptoms. You could be walking around with a high blood pressure and not know it, and have a significant event later because you were not aware and didn't get it treated. Men are at higher risk for hypertension than women, and at ages 30 to 55 is kind of where people see that their blood pressure goes up. So those are some things that you really don't have any control over. Family history, you don't either. But I think that there are some things that you can do in your everyday life that can prevent hypertension for some people, and that's things like smoking. So smoking cessation, really eating a healthy diet can also reduce hypertension. As far as like your sodium intake too, salt intake, really watching those things. Sodium can sneak in on so many foods and you're not even aware of it. So paying attention to food labels and just being aware of what you're taking in your diet can be helpful as well. Watching your weight, so making sure that you're at a healthy weight and doing things every day to stay active, because inactivity can also play a part in that as well.